Hi there, welcome back to the channel. Glad to have you here. I'm going to start this a little different. If you haven't subscribed to the channel yet, please do so now. Click on like on the video so we can put this in front of more people. Today we're going to talk about the importance of combining medical therapy with surgery in hair restoration surgery. So pretty important topic to discuss. We're going to go over some importance of that and some key factors. So stay tuned. Let's go ahead and get started. Hi there. So today's video, we're going to talk about the importance of combining medical therapy, medications with surgery for the best optimal treatment for hair loss. Very important topic. I get this discussion multiple times during the day as I do my consultations for hair loss. One of the questions I get a lot from patients is like this: if I can have surgery to replace the hairs I've lost, why would I worry about treating my hair loss with medications? I don't want to be on prescriptions. I don't want to be taking drugs the rest of my life. My answer to that is, if you're not doing medical therapy, you're missing out on a lot of benefits, okay? I have been through the process. I am going through the process of restoring my hair. I have had transplants. I take medications every day, the same thing I prescribe to you. I take it myself, so I'm also a patient, right? So I treat my hair loss as well daily. And these medications that we're going to talk about, they're very safe. They're very old. They've been used for many years, so we know a lot about them. There are some misconceptions about them on the internet, so the best thing you can do is to let us clarify those concerns for you. And we have, evidence or studies that can show us how safe they are. There's always potential for side effects like anything else, right? But the important thing is I find that people are a little bit misled sometimes by what's out there. So the best thing to do is to consult with me or someone that specializes in hair loss. And if you've been to a consultation and all that was recommended was a procedure, then you're missing out, okay? It's very important. Now, one of the things, why is medication important, right? Because hair loss is progressive, number one. It tends to get worse with time. It doesn't get better by itself. So what you see today on your hair, if it's starting to thin, if you don't address those hairs, they're gonna continue to get worse. They're not gonna get better by themselves. The medications are great to try to prevent you from losing more hair. The younger you are when you start losing hair, when you start seeing hair loss, that's a predictor for how severe your hair loss might be. Again, there's exceptions to this rule, but if I have a patient that's been thinning in their 20s, chances are he's going to be a lot more bald or a lot balder than someone who started thinning in their 30s or 40s. So again, the more exposure to hair loss you have, the younger the onset of the age of the hair loss, the more potential for severity it is, right? By the time you see an area that's thin, in other words, by the time you start to see your scalp, keep in mind that more than 50% of the hairs in that area are already gone. That's a very important concept to have because you just don't know how much hair is lost, and by the time you notice it, it's already almost too late. So best thing is to be proactive. As soon as you notice an area that's getting a little bit weaker, the caliber of the hair is changing, it's the time to consult with us so we can save you hair, okay? So what are the fundamental problem is the hair militarization. So when you look at the hair loss or androgenic hair loss or male pattern baldness, the same thing applies for females too, for women. The hair doesn't just die off one day. What the hair that you see when you brush your hair, that's shedded hair. That's different than hair that's being lost by hormones and genetics. The process of hair loss with hormones and genetics is more of a slowly progressive weakening of the hair follicle. The hairs will decrease in diameter, they will decrease in hair color. Their growth phase, the anagen phase, will become shorter over time, and eventually it leads to areas of thinning or baldness. So hairs can miniaturize, can go from a full hair to a very weak hair very fast within a year or two. It can take years if it's a slower progression hair loss. It varies greatly. There's no way to predict it, but the sooner we can intervene, the better for you, right? So, and I get that question a lot from the patients. Well, what's the point of no return? So I have all these little hairs in my head. I know it's getting thinner, but I still have some hair. How many of those can actually get better? That's hard to tell, but what we know is by the time the hair becomes really, really small, really, really fine, it may stay that way with medications, but we won't be able to reverse it probably, to any degree of noticeability. If you come to me and you have a lot of hair still there, but you can notice some spacing, the hairs are a little bit thinner, but still viable, with medications, we can stop the damage. In other words, freeze the hair loss or slow it down, and we may be able to get these hairs to get actually better. So again, the sooner you get to us, the better it is. Keep in mind, and that's a very important concept, hair transplant replaces hairs that were lost. It is not a treatment for hair loss. Treatment is medication. Transplants are for repopulating areas that have been lost. So that's an important concept that a lot of people don't understand because they just haven't been told that, right? So the medical treatments for androgenetic alopecia or male or female pattern hair loss, it has the following goals, right? It protects the hairs against the dihydrotestosterone or DHT. If you remember from our previous videos, if you watched it, hair loss, male and female pattern hair loss, is a combination of genetics and also the action of the dihydrotestosterone, which is basically testosterone that gets converted to DHT. And so if you don't have both of these things, if you don't have genetics and dihydrotestosterone, you're not going to lose your hair. So if you are thinning, it's because you have both. So the aim is to protect the hairs against the DHT. Not affect your testosterone. We don't want to lower your testosterone, but we want to protect the conversion from testosterone to DHT. The secondary benefit is that with the protection, with the lowering of the DHT, the hairs may increase their diameter. In other words, they can get a second breather or a second wave of growth, and that can get actually stronger. We see this a lot of times in patients as long as they start the treatment early enough and as long as they're consistent, okay? So the goal is to slow down progression of hair loss. If we get increased coverage, increased density, that's great. It doesn't always happen, but in my view, even if we can slow it down, it's better than not doing anything and letting it just run without any control. A treatment for hair loss, a medical treatment, can actually convert a patient that's a marginal candidate for a hair transplant surgery into a good candidate. In other words, if I see a patient in consultation and that guy or gal is getting really thin, the hair loss is progressing greatly, I don't have a good sense of where he's going to stop or how much hair he or she are going to lose in the future, it may be a little dicey for me to recommend procedures because I don't know if I'll be able to keep up with the hair loss, right? And so it becomes a little bit challenging. If that patient has been on medical therapy, stable hair loss, they're consistent with their treatment, I feel more comfortable that I have a handle on their progression, so therefore I can more comfortably recommend a procedure for those patients. So that's another importance of the medical therapy as well. Another benefit of the medical therapy for hair loss is that it enhances the results of your procedure. So we published an article, I was one of the authors. It's an article that gets cited a lot, means that a lot of people that are writing articles on hair loss refer back to that research. It was done a few years ago, and we basically studied two groups. One group that was taking finasteride medication for their hair loss and had a transplant. The other group was not taking finasteride and had the transplant. It was a double-blinded study, meaning that patients didn't know whether they were on the drug or not. I didn't know either. I was just provided with pills that were unmarked, and we had groups A and B, and we just gonna split them up. At the end of the conclusion of the study, of course, as we expected, the pictures and the hair growth measurements showed that patients that were on finasteride and had transplants did much better than patients that only had transplants. Why? Because the transplants grew just the same between the two groups. When we do transplants, as you probably remember, we are using hairs that are embryologically different from the hairs from the top. So these hairs here do not have receptors to dihydrotestosterone or DHT, so they don't fall out genetically and hormonally speaking. So when we transfer them into the balding areas, they carry that genetic code, so that resistance to DHT, so they grow. Two groups showed good growth of the transplants. The difference was the group that was taking finasteride, they had no DHT or less DHT to affect their hair over time. So their hair was their negative hair, the hair that was here, was maintained by the medication while the transplants grew in between. So they had an augmented response, right? The other group, they kept losing their hair because they were not on finasteride. Transplants grew in, but they didn't have as robust results. So medical therapy is important too because it augments or enhances your results from surgery. These are some pictures just to illustrate my point. This is a friend of mine, a patient. So you can see here, we transplanted the front and the top of his scalp. You can see how there's more hair here than here, right? We didn't do anything in the crown for him, transplants wise, but he was on finasteride for his hair loss. Notice here how much better his hair looks all around the periphery here from the medication alone. It's a small difference, it's subtle, but you know, the medication actually improved his hair and decreased the zone of baldness around the sides and the lower area here. Remember, this is not transplants. Transplants are only up here. So that's to show how important that is. Another example here too. This patient did not have surgery, it was just medical therapy, just finasteride and minoxidil. And you can see here the before pictures after a year, how much more hair he has in the crown. So, and I see this all the time. These are not outlier patients. These are not guys that had the best response, right? I see this quite a bit in my practice. So that's why I'm so adamant that my patients are on medical therapy. So if you ever come to me for a consultation, you better bet that I will be recommending medical therapy for you to some degree, right? So in conclusion, we need to educate you and you need to educate yourself on the benefits and the risks of the medical therapy. I go through all that in my consultations, so if you want to talk to me, I'm available. We need to approach it as a protection on your investment, right? So if you go through a hair transplant, you're investing time, you're investing some money, you're investing, your goals or your appearance to us. And so it protects you if you are treating the rest of the hair along with that. So, it's another way to look at it. And, a lot of times what I'll do is I'll start medical therapy first. So let's say you're coming for a consultation, I may tell you, let's not do transplants right now. Let's hold off on it. I need you to be on this medication for at least a year, maybe 6 months, whoever the time may be, because I want to make sure of two things. Number one, that you can take it, right? That you will take it consistently and that you're not going to have any side effects. That way I will know that you can continue to take it and I can make the plan for your surgery better for both of us, So that's it. Just a little quick video. It's very important, the medical therapy. I talked to all the patients about it. So don't let yourself be scared by what you see out there. These medications are safe, they're effective, and I've been doing them for many, many years. So you want to talk to me, let me know, give us a call. I'll do a free consultation for you. We'll discuss all these things. Again, like I said in the beginning, please like the video, subscribe to the channel if you enjoy what we put out. It's the goal is to educate patients here, and hopefully this was good for you. All right, I'll sign off here. I'll see you next time. Take care.